Right, welcome back, everybody. Day 96. I cannot believe that we're heading to 100 days of lockdown in South Africa, and many people are either frustrated by all the lockdown regulations or are fearful that COVID-19 is edging closer to them. Or, let's add this category, and they're tired of hearing about it and are just going about life as normal. Now, this is especially true for people who, unfortunately, in and amongst all of this, have lost loved ones to COVID-19. My next guest has a warning for South Africans not to develop what is called epidemic fatigue, as it may increase the risk of infections. Dr. Kerrin Begg, a public health specialist at the University of Cape Town, joins us to discuss this in more detail. Dr. Begg, thanks for joining us. Good to have you on the program.
Good morning. Good morning.
I think I know what epidemic fatigue is, but let me get the definition from you. In my mind, I can understand what it is, but obviously there's a much more scientific explanation.
So it's got to do with the psychology of how we engage with fear and our responses. So you would have found yourself at the beginning of COVID, first of all, trying to convince people that this was indeed serious, and making sure that you did everything that you needed to do for obeying all of the golden rules of washing your hands and making sure that you stayed at home, physical distancing, etc. But what happens in your brain over time is that fight or flight response to urgent threats becomes fatigued. So what you see now, which is obviously greatly concerning, is that the fear response has now passed, and people are returning to the same old normality of life, and not adhering to all of those. And so it's this low motivational energy to comply with safety guidelines. So it's a bit like an alarm going off regularly. That initially, a house alarm, for instance, you jump up and you respond. But when it happens frequently, you stop responding to it anymore because you don't take it seriously, because what you heard about it doesn't seem to resonate anymore.
Yeah.
And so it's part of a chronic stress response with a decreased sensitivity to warnings and the inability to process new information. And so it's a very real, both a mental and emotional response, but very important to be aware of it taking place, and then to adapt and make sure that you actually then start to do it from a much higher place rather than a fear response.
Well, this is the thing. I mean, there's just, I hear it all the time from people, especially those that now have to travel and go to work, and they're basically just saying, well, you know what, if I get it, I get it, but I have to get on with my normal life. What happens to a person here mentally, especially as they don't really have an economic choice? You're going out because you need to put food on the table, but the danger is there.
So I think that what it really is to understand that even though, even though we need to go to work, there are things that we can still do to minimize the risk. And what we really need to understand is that that this is a disease of aggregation or congregation. And so gathering together needs to be limited as much as possible. So whilst we need to go to work or go to school to earn a living, what we can do is make sure that we stop, that we don't meet for socially or allow our kids to play contact sport in the park when we do go out, or have dinner parties. So those are the things that are really difficult to continue with. So we need to take over from the base of our brain, which tells us that the urgent threat is now gone. But what we do need to do is start thinking about that we need to now start making sure that we understand that our behavior affects others. And so that even though somebody in my immediate nature isn't affected, or infected, and perhaps even if my children or me or my friends around me may not get it seriously, there are others who will, and that my behavior affects others and their behavior affects me. And if we start doing that and rather do things from a social solidarity point of view, that I am protecting others and protecting society as a whole, rather than from a fear response of what if I get it? Yeah. Because the what if I get it is not really where we want people to be, but it's also people have grown tired because that's exactly the fear response that is no longer working.
Yeah.
So we need to move beyond that. Make sure that we do self-care, make sure that we find other ways of engaging and interacting with people so that we get our fulfillment and get our self-care, so that we're not operating from a fear response, but from a social solidarity response. So have dinner parties, but across Zoom. Have play dates, but across Teams. Have, whatever it is, just do it from a place of careful thought and thinking, rather than from a fear response, because the fear response is no longer working, and that's appropriate.
Yeah, well, I mean, it's easier said than done, I suppose, because, there are some people that, as much as they'd love to travel to work via Zoom, they can't. And the problem is that you've got taxis that are now disobeying the rules and the laws, saying they're going to fill up 100%, they're going to do interprovincial travel. We're seeing now more airports opening around the country, restaurants are opening, casinos are opening, movies are opening. So life as we may have known it before we went into lockdown is resuming. Whether we participate or not is up to us, and that's a big decision we need to make. But it is somehow it's when the temptation is there, many people take it and say, well, enough is enough, let's go for it.
Yeah, so I think what we have to do is kind of get into a new normal, have new habits. So the new habits would be that if I don't, so whilst my choices might be limited in terms of returning to work, that there are still choices and engagements that we can make with employers. So change the times of getting to and from work, so that if you are having to use public transport, that you are able to use it as safely as possible. Make sure that you are hand sanitizing and challenging people to wear their masks, wear your own mask, and be as responsible as you can be, and talk to others, not from an accusatory or fear-based response, but really, let's do this together. Let's heed the president's call from a number of years ago, Tumamina, send me, that each of us actually become responsible citizens to do what the right thing is. Schools are actually relatively safe at the moment because of the controls and measures that they're putting in place around social, physical distancing and sanitizing, etc. The concern is really around congregation of children during break time and after and before school. And the same happens in workplaces. So workplaces are having to adhere to rules and guidelines, but are also, for the most part, being fairly responsible. The challenges come when people decide during lunchtimes to congregate in small spaces, take their masks off because they're now eating, etc. And so those are the places where each of us has choices, and to be responsible citizens in making good choices to protect others and those around us. So it's we now need to move to higher functions of our brains and not just rely on the brainstem of the knee-jerk reaction of flight or fright or fight. But we need to be responding with the social solidarity of caring and compassion. Yeah. And that really is the conversation that we need to be having with others, is let's care for each other, let's be compassionate. Let's remember that whilst I may not be as severely affected because I don't have comorbidities, and I'm not particularly old, but nevertheless my actions may well impact others, and so let me be as safe as possible to protect others around me.
Yeah, I like what you just said. We need to move to a higher level of understanding in our brain, because we need to, this is where maturity almost needs to come in, is that we can't be told that we have to go into that hard lockdown again, where we lock ourselves away from the world and we let this virus go, because that is not a normal life. And unfortunately we do have to go out there, we do have to resume our lives and live and carry on like this. But I often hear this a lot from people, we wonder if perhaps we went into this lockdown a little bit too early as South Africans, and that now where we are seeing the rise in numbers and where we are seeing, this was always expected that we were going to get the rises at this time, that, you know, maybe this shouldn't have been the case and things shouldn't have been this way, but, you know, we can never look back and change history. Perhaps it was right what we did, but, you know, as a health specialist, how do you feel about so much opening at a time when we are entering into the most dangerous part for the pandemic?
It's an incredibly difficult balance to get right, and I think that what we all need to recognise is that there are almost no right answers. They're just worse and less bad answers and choices in terms of government. I think what we need to understand as citizens now, this is not about obedience to laws. Whilst that is important, this is now really about choice to do the right thing, rather than, the lockdown regulations allow me to do X, Y, and Z. And so the lockdown was an important and very blunt instrument at the very early part of the epidemic to make sure that we didn't have the rapid escalation very early on. And so we did buy ourselves some time. So we had a delay in the rapid escalation of cases. So whilst it was very early, to some extent, what we did do was allow COVID to get into the psyche of the population quickly and understand its seriousness. The con, of course, is that it built on the fear response. And I think particularly, perhaps what we could have done better early on is that the messaging from government was really around a wartime. So it was an enemy to be defeated with soldiers and the front line. And perhaps that militarizing of COVID was not particularly helpful because the enemy is not as vivid now. And I think we could have worked better on the social solidarity response earlier. I think that had we done that, I think that would have been more beneficial now to have got the messaging right.
Yeah.
And so now we're trying to backtrack from that enemy messaging and wartime messaging to a more social solidarity.
Yeah. Dr. Begg,
so it's difficult to know whether delaying it, we may well have actually had a more severe epidemic. But if you look at countries like the United States, with incredibly severe numbers, with very little lockdown early on, there's been the complete polar opposite of what one would expect.
Yeah.
And people, in fact, deliberately aggregating and congregating and deliberately challenging science.
Yeah.
And so that's also part of the dilemma.
One final question that I must ask you, and just as we wrap the interview, there are a lot of people that have been going to work throughout this, and essential workers as we call them, particularly those that have been tirelessly in the hospitals working, our nurses, our doctors. It's the first time that I've actually seen videos starting to surface of South African doctors and nurses talking about how tired they are, how, please stay home. We can't cope. We're falling under the pressure, and we're seeing people getting infected on a daily basis. We don't know what to do. This is also something that we perhaps haven't really focused enough on, is the toll that it's taking on those in the front line. And this pandemic that we are here for, this is not going to go away next month or in August or September. This is with us for maybe a year or two still to come.
Yeah.
What do we say to them?
It's incredibly difficult, and I work with my colleagues on a daily basis. We're bringing students back. Our colleagues are ill. They're going off sick. Some of them, the few are, we are also having those colleagues who are passing away, and that's just the immense tragedy of a pandemic. And it is devastating, and I think it's for them that I feel the most when I see, when I take personal umbrage to people returning to so-called normality. So we're working very hard to support our colleagues who are at the coalface of this epidemic and treating those in the wards. And it is incredibly difficult for those of us who are close by, is just to make sure that their mental health also stays at coping levels, that they are provided with the opportunities to step back as needed. But it really is an immense challenge that we have a workforce, a health workforce that is broken emotionally based on this. There is no other disease other than COVID right now in hospitals, certainly in state hospitals. You're either investigating people for COVID or you're treating them for COVID. There pretty much is nothing else. And I think that the huge concern for us is that after this, we are going to have the tsunami of the non-COVID diseases that are currently sitting, getting worse at home because people are too afraid to go to their health facilities, or there's simply no outpatients and no bookings to be had. That we are going to see, we're going to have an excessively strained healthcare system for a protracted time to come. So it's not like things are going to get easier once the COVID pandemic starts to diminish, but actually the health system is going to be even more overwhelmed with all of the now diabetic, hypertensive complications that have previously would have been picked up at mild levels will now be much more severe and will need to be treated. Surgeries that are being delayed and deferred, and therefore the pathology is getting worse. So it really is of grave concern to us. And I suppose that's part of the appeal to the public is, please, care for others, be caring and compassionate, not just to those who would be getting COVID, but to those who are treating COVID. That actually we need to get through this with as little damage as possible, so that our doctors and nurses and physios and OTs and all of our healthcare workers can and cope and be there when you need them for your other disease processes as well.
All right, Dr. Begg, thank you. Thanks very much for talking to us here. Dr. Kerrin Begg is a public health specialist at the University of Cape Town, educating us on and warning South Africans about epidemic fatigue as it may increase the risk of infections. Let's take a break. We'll see you after this with headlines and then sports news. Stay tuned.